a project investigating how we can improve the school environment for sexual and gender minority young people.
In our project, we investigated whether promoting inclusivity and acceptance of diverse sexual and gender identities in schools could reduce depression and anxiety among sexual and gender minority young people. This is because young people who are sexual or gender minorities are more likely to experience depression and anxiety. This includes young people who are queer, lesbian, gay or bisexual, transgender, non-binary and gender diverse. We were interested in universal interventions aimed at all students or all teachers. We analysed data from 54 research papers and spoke to 8 young people who were sexual or gender minorities and had experienced depression or anxiety themselves. We also spoke to teachers, school governors, and policy representatives.
We found 4 main types of intervention which work to improve school life and mental health for sexual and gender minority young people: gay-straight alliances or pride clubs, LGBTQ+ inclusive anti-bullying and harassment policies, an inclusive curriculum, and one-off workshops such as films, panel discussions, and photo exhibitions. These interventions could work best when teachers are properly trained to implement an inclusive curriculum and they're aware of school policies so that they can implement them. These interventions are also more likely to be effective when one-off workshops are delivered by LGBTQ+ people and school leaders and the wider community are supportive of these interventions. Importantly, as one young person who we worked with explained, pride clubs are only going to be effective if the wider school environment is supportive and young people aren't singled out and bullied for attending them.
Well, we didn't find many studies that had examined depression and anxiety specifically, so we need more studies in this area. 65% of the interventions were implemented in North America, so we need more studies in lower income countries. And to kind of wrap things up, our results will provide guiding principles so that schools can create more inclusive and accepting environments to improve the mental health of sexual and gender minority young people.